Hey, hello. Good morning, everyone. My name is Kalechi Bay Lamberts. I'd like to welcome you on behalf of the Aurora African American Health Coalition to our event on Black perinatal mental health with Dr. Anquinette Perkins. Before we proceed, I want to take a few moments to introduce our guest speaker for this morning. Dr. Perkins is an assistant professor of social work at Aurora University with over 25 years of experience in social service provision. Dr. Perkins has personal and professional interest in addressing the lived experiences of Black women with a specific focus on maternal morbidity and mortality rates as descendants of enslaved Africans in the United States of America. Volunteer services also include a membership in task forces addressing reparations for the descendants of enslaved Africans in the United States. Most recently, Illinois Lieutenant Governor Juliana Stratton's Healing Centered Illinois Task Force. Thank you so much, Dr. Perkins, for your time. Welcome, and we will begin.
Thank you for having me.
All right, let's go.
So again, thank you for having me and good morning. Welcome to Perinatal Mental Health, Wellness Among Black American Women. Next slide. I want to point out by introducing you to my daughter, Chloe. And again, this is to be vulnerable, right, to the audience, to show my vulnerability that I have my own personal experiences with perinatal mental health conditions. My daughter, Chloe, was born 3 months early. And if any of you are aware with prenatal histories, that meant she was in the neonatal unit for 3 months. But I also have a very professional interest in perinatal mental health conditions among Black women. And that is based on my previous employment, where I worked with high risk pregnancies, particular women who were living with HIV, but also pregnant, while dealing with a very young client who found out she was positive and pregnant at the same time. Of course, there was some form of depression. And trying to better serve that client, I did a little research on working with women who are experiencing depression during pregnancy, and that is how I became more aware and more familiar with perinatal mental health conditions. Um, that very young client, I believe she was in her early 20s, did end up passing away from complications due to pregnancy. And this was just a couple of years ago. And so, in her honor, I felt it necessary to continue to work with a special focus on Black American women and their pregnancy experiences, because I do believe that it is a beautiful experience and it can be a joyful journey when women have the correct or the proper support system. So, again, just to be a little bit vulnerable, I have my own experiences with PMHCs, but again, I do this in honor of my very young African American patient who passed away way before her time, before being able to experience the joys of being a mother and just continuing on with her pregnancy. Next slide. So, I do want to start off with saying that this discussion will focus on the descendants of enslaved Africans and Americans. So, when I'm referring to Black American women, I am referring specifically to those who are descendants of enslaved Africans and Americans. This is not to discount the experiences of any other groups of Black women that are in the country. My focus on the descendants of enslaved African Americans is because literature has shown that intergenerational factors closely related to lifelong minority status contribute to the African American women's reproductive disadvantage. If you go on to research and read the article, you will see for yourself, for lack of better words, right? What the researchers found was looking at a at African women who immigrated to the United States. Upon entering the United States, their pregnancy rates very much resembled those of white American women, meaning there weren't the complications of premature births, the large numbers of complications of premature births, or giving birth to low birth weight babies. As the study moved forward, what they found was that the actual children of those immigrants, when they began to have children, that's when their pregnancy rates started to resemble those who were Black women, descendants of enslaved Africans in America. So basically, what it's saying, the longer that the African immigrants were in the United States, or the people became part of the society in America, that the discrimination and the stress of dealing with the discrimination began to affect their reproductive status. So again, I encourage you to read that article on your own, and of course, we can talk about it a little bit more after this. Next slide, please. So who you're looking at now is Melanie Blocker Stokes. When I've spoken at other events or with other individuals, there's always the comment, well, you know, Black women don't deal with depression and stress. That's not our issue. That's white women's issues. So I want to introduce you to Melanie Blocker Stokes, who was from Illinois and experienced postpartum depression and postpartum psychosis, and ended up completing suicide in 2001. And what happened with Melanie is that, again, after delivering her baby, within a month, she developed postpartum depression. And due to the experiences with psychosis, she took her own life by leaping from a window on the 12th floor of a hotel in Chicago. So her information, the link is in the slide, but I hope that you will take the time to research her background. And again, another story where mom was not able to get to enjoy the journey that is motherhood, due to not receiving the mental health services that she needed after giving birth. So again, just to bring it home a little bit closer to everyone, this again, this happened in Chicago, this happened in Illinois. When she passed away, she did leap from a hotel room in Chicago. Next slide. I think you went. Can you go back one? Can you go back one slide? Okay. So we're going to talk about the prevalence of perinatal mental health conditions among Black American women. And what does that mean? That's just the statistics. How prevalent is this really a problem for Black American women? So what we know is that perinatal mental health conditions are the most common pregnancy and birth complications. Almost 40% of Black mothers and birthing people experience maternal mental health conditions. You will see PMHCs and MMH throughout the slides. They are synonymous. It just depends on the organization that who's reporting. And because I'm certified through Postpartum Support International, I usually refer to them as PMHCs, but it is the exact same thing. Compared to white women, Black women are twice as likely to experience MMH conditions, but also half as likely to receive treatment. Black women experience maternal mortality rates 3 to 4 times the rate of white women. Black women are one of the most undertreated groups for depression in the US, which is very surprising because it is extremely hard to be a Black woman in the United States. Yet we are the most untreated group for depression. Over 50% of postpartum depression cases in women of color go unreported, which is another conversation. 50% go unreported. Is it because the women aren't aware that they may be experiencing postpartum depression? Or is it a more cultural where we don't discuss our mental health issues, or trying to live up to society's beliefs that motherhood is this beautiful journey that comes without challenges, right? That you should be smiling and happy because you have this beautiful child. Not allowing a safe space to really say what the experiences of motherhood is directly after giving birth. Next slide, please. So, what is perinatal mental health? You'll see that I have wellness in parentheses because we want to look at this from a victorious point of view, from a strengths-based perspective, right? We're going to talk about some very concerning things, but our goal is that this presentation will be an awareness that after having attended this webinar or having received this information, that you don't feel negative, but you feel enlightened. That yes, I have this information and now I'm going to go out and share it with everybody else so that doing my part to educate other Black American women on what PMHCs actually are and what we're doing about it. Okay. So, again, the organization that I'm certified with, Postpartum Support International, defines the perinatal period as the time frame from conception through the first year of pregnancy. Perinatal mental health addresses the challenges, complications, disorders, and conditions of mental health during the perinatal and the postpartum period. The definition encompasses the risks at any stage to include the fluctuations in hormones during pregnancy, post birth, onset of lactation, weaning, and the reemergence of menstruation. Meaning that when we talk about perinatal mental health, we're talking about from the beginning stages of pregnancy when the body starts to prepare. How does the body prepare? By hormones turning on certain things, the fluctuation in the hormones once you deliver and the hormone situation drops, but also the hormones that are needed for lactation, breastfeeding, right? When mom is starting to wean and where she's about to stop breastfeeding. Again, the hormones will drop. And then, of course, we all know that there are hormones that influence the reemergence of menstruation. Okay. And so, again, as we touched on in the previous slide, we do know that perinatal mental health conditions are the most common pregnancy and birth complications. I want to just bring it a little bit closer to Illinois for a minute to say that the number one birth complication in Illinois, or pregnancy related cause of death in Illinois, is from substance use. At this moment, it is white women in Illinois who are dying as a result of substance use disorders during the perinatal period. And much of that is influenced due to the increase in opioid use. But that is not to discount anything that Black American women in Illinois deal with, right? Again, right now the deaths are occurred to the opioid use, but Black American women are still dealing with perinatal mental health conditions as a common factor in birth complications and even death during the pregnancy stage or the perinatal stage, which again can lead up to 1 year after delivery. Next slide. So, when we talk about perinatal mental health conditions or PMHCs, I think it's important to distinguish between PMHCs and the baby blues, okay? So the baby blues, about 80% of women will experience the baby blues after giving birth. This is expected, okay? It's common to experience the mood challenges after pregnancy and up to 2 weeks. And again, it is because specifically the fluctuation in hormones, again, those that are needed during pregnancy, during lactation, and then afterwards. The and on blues. Comes with after treating with symptoms of depression or something about it may be something more than baby blues, and this is when we want to seek out the assistance of a professional. So again, baby blues are not the same as PMHCs. Baby blues are expected due to the fluctuation in hormones after pregnancy. It is common for this to be after the first 2 weeks after delivery. If it extends beyond 2 weeks after delivery, again, there may be reason for concern. Okay, next slide, please. So, what are PMHCs? PMHCs are mental health disorders that one would find in the Diagnostic and Statistical Manual, meaning there is already a diagnosis of depression in the Diagnostic and Statistical Manual, or the DSM. What the concern is that when we add perinatal to it, it is because these situations occur during or because of pregnancy, or after childbirth, which is postpartum, and then also with loss of pregnancy. So again, just because the pregnancy ends does not mean that things just go back to the way they were immediately. There will still be that fluctuation in hormones that can influence the mom's mental status. So when we talk about PMHCs, we're talking about perinatal depression, we're talking about perinatal anxiety, we're talking about perinatal obsessive compulsive disorder, which we'll refer to as OCD. We're talking about perinatal post traumatic stress disorder, which we're going to refer to as PTSD. We're talking about the bipolar mood disorders 1 and 2. And we're talking about perinatal postpartum psychosis. And again, this is what Melanie Stokes was dealing with when she took her life towards the end of her taking her own life. Next slide, please. So let's talk about the symptoms so that we're more aware of what we're actually looking for. Again, some of you who are, may have experienced pregnancy or may have been around someone when they were pregnant. Some of these things, these symptoms will sound, well, isn't that expected after a mom has a baby? Some of this is expected. Remember that situations become a mental health concern when the symptoms or the situations interact or cause the person challenges to actually going through life in a regular way, if you will. So it becomes a problem when the symptoms actually are exacerbated, and there are challenges to the person functioning in life, if that makes sense. So, with perinatal depression symptoms, you're looking for irritability, sadness, guilt, hopelessness, loss of interest, crying spells, appetite or sleep disturbance, thoughts or concerns about hurting the baby or herself. So, again, some of you are thinking about, well, who sleeps when they have a newborn baby? Of course, they're not going to eat. You don't have time to eat. Of course, you're crying because you're tired, right? Again, all of this is a focus on the baby or the pregnancy or the delivery itself. So when you're looking at perinatal depression, you may look at this woman going from being extremely excited about being a new mom to, I'm not interested in dealing with the baby, or you have to continuously bring the baby to mom to remind mom to feed the baby, or mom gets to the point where she doesn't want to interact with the baby at all, right? This is when it starts to become concerns. Or if you try to bring the baby to mom and mom rejects the baby, saying something like, I'm not worthy of being the child's mom. I don't think I can, I don't think I can deal with this. Um, I don't think I'm going to be a good mom, right? This is when you start, there's concern for mom's care. Perinatal anxiety, the constant worrying, the racing thoughts, the physical symptoms, dizziness or nausea, or intrusive thoughts. Again, people are probably thinking, well, of course you're worried. You're a new parent. It is the constant worry, right? It is the constant questioning of, am I going to be able to do this? Can I do this? They're telling you that their thoughts of, it's what I have to do from the moment I wake up until I end. Start going into the future. Because what is anxiety? The fear of the unknown. So you have mom already talking about, I'm not going to be able to afford college for this child, or I'm not going to be able to date again, things like that, where it's just, again, we all worry. It's when it becomes to a certain extent. Perinatal PTSD, hypervigilance, flashbacks or nightmares, anxiety attacks, and dissociative episodes. When we talk about perinatal PTSD, I really hope the audience would think about actual birth trauma, if you will, right? And we'll talk about this a little bit more, but when we're talking about PTSD, we could talk about unresolved trauma, meaning trauma that could have occurred prior to pregnancy, maybe even in the developmental stage, and mom never received treatment for it. Or pregnancy, again, those hormones that could trigger something where mom may have already received treatment and worked through that trauma. But again, the fluctuation in hormones may have triggered something. Or in the case of some moms who I have spoken with, the trauma of dealing with prenatal visits where they have expressed having providers coming into the waiting room and immediately just begin touching the mom. And in some cases, preparing for vaginal examinations without even introducing themselves to the mom, right? That trauma of losing autonomy or control over your own body. Again, this could be something that develops, or an interaction during the prenatal visit could actually trigger something. Okay. And then, of course, the actual delivery process itself, right? Some moms have an idea of what the pregnancy and the delivery will look like. I can't tell you how many moms have experienced or expressed trauma when their birth plans didn't go the way they wanted, when the expectation was a home birth or a water birth, but it ended up mom went into labor when she was at the movies 2 months early and ended up being taken to the local hospital and receiving instead. I've had a lot of moms who talk about the trauma of having a cesarean or having had a cesarean when their goal was not to have a cesarean at all. And then, of course, those are those who have expressed the trauma of interacting with the healthcare staff during delivery and the disrespect of the Black woman while she's giving birth. And in the case of my client, had she lived through her situation. Um, I had actually seen her the day that she passed away. She had come into the clinic for services. And then later on that evening, something happened, and she went to another hospital where she had learned that the baby had died in utero and she was delivering the fetus. So can you imagine the trauma of just hearing your baby earlier that day, your baby is fine and alive, and then later on that evening, you go to the hospital and they tell you your baby has passed away in utero, and then you have to deliver the. So the trauma of that, had she lived through that, it would have been traumatic. After she delivered the baby, oh, well, actually, she passed away while trying to deliver the baby, and they brought her back. After she delivered the fetus, they took her to her room where she then coded again, and she ended up dying. So again, that whole experience, had she lived, I can only assume would have been traumatic. Again, learning earlier that you were listening to the baby's heartbeat, only to a few hours later to learn that the baby had passed away and you were being required to deliver the fetus. And then I'll touch on my own and I'll move on. My birth experience, again, where here I am doing everything that I thought I could to have a healthy developed preeclampsia, and my daughter was delivered 3 months early, right? So again, having those expectations of what your pregnancy and your delivery will look like, and then it changing drastically. That's what perinatal PTSD can look like. And then, of course, there's the bipolar disorders 1 and 2, the mood swings, the rapid speech, the unusually high energy, impulsivity, delusions, and hallucinations, perinatal psychosis, again, which is what Melanie Stokes was dealing with, the paranoia, the holding strange beliefs, and the difficulty in communicating. And then the last, but certainly not least, is the perinatal OCD. Actually, perinatal anxiety and perinatal OCD are more common than postpartum depression, But again, they tend to go unreported or undiagnosed because, again, many attribute this behavior to just the behavior of new parents or a new mom or worried mom. But actually, perinatal anxiety or perinatal OCD in itself deals with an obsession, unwanted or intrusive thoughts that continue to even though mom tries to think of other things. Um, and they usually are followed by compulsions or repetitive behaviors or rituals that mom tries to use as a coping skill to deal with those unwanted or intrusive thoughts. And I'll give you an example and we'll move on to the next slide. And it's something that I have seen a lot is with moms that come up with thoughts of contamination, right? So something that may sound a little bit simple, but really isn't, is a mom who decides to use formula. And so then she starts to have these thoughts of, is the formula that I'm giving is it has poison in it, and I can't give this to my baby. Or then she begins to talk about the formula on a regular basis, and then she comes up with rituals or behaviors that she believes will help um, lower the risk of the child being contaminated or being poisoned by the formula. So, a compulsion or a behavior that mom may come up with to deal with her beliefs that the formula has poison in it is, say, to drink 4 gallons of water herself prior to giving the baby the formula or making a bottle for the baby. Again, these are extreme, what I'm explaining. It could also be something as simple as mom refusing to touch the baby until she's washed her hands at least 5 times. Okay. I think with COVID, we all became a little bit more robust with washing our hands, but it's to the point again when you're washing your hands so much that it's actually starting to add to deterioration on the hand, like the skin is starting to peel or something because mom is obsessively washing her hands, trying to make sure that she doesn't contaminate the baby in any way. So again, some of the symptoms of PMDs, and we move on to the next slide. So everyone or every woman who wants to experience pregnancy is at risk for a PMHC, right? What makes the experiences of Black American women different is the lived experience of Black American women, those unique stressors that are added to our lives that may not necessarily be experienced by a Mexican American woman or a Scottish American woman, right? So the lived experiences that include historical and intergenerational trauma, the experiences that include systemic and institutional racism through the healthcare system, the experience of epigenetics, the experience of the weathering hypothesis, the interpersonal challenges of pre-existing mental health conditions that may or may not have gone untreated for whatever reasons. Sometimes our culture, even though we're getting better, may not have a belief in mental health issues. We'll just pray about it, right? Or intrapersonal challenges like community violence or living or growing up in an impoverished area where you may not have access to things that could have put you in the best health conditions during your pregnancy. So we'll talk about that a little bit more now. Next slide, please. So, starting off with historical and intergenerational trauma, what you're looking at now is a painting of Anarcha, and we'll talk about Anarcha a little bit. So, what we know about historical and intergenerational trauma with the Black American woman is that Black women enter pregnancy and childbirth suffering the impacts of intergenerational trauma, including the knowledge that many obstetric and gynecologic procedures were tested on Black women without their consent and without pain medication. And this is a painting of the examination room of Dr. James Marion Sims, and the one you see on seated on the exam and examination table is the borrowed enslaved woman Anarcha. Um, and what you're looking at is Anarcha is about to go through a vaginal exam, including surgical procedures without any type of sedation. And anyone who's experienced the pelvic exam may know how uncomfortable that is. Now, imagine that with scalpels and sharp instruments, and again, without any type of anesthesia or sedation. And you're looking at white male medical students, and in the background, you'll also see other borrowed enslaved women in the background. You see them there because Dr. James Marion Sims would use the medical students or the other borrowed enslaved women to restrain Anarcha and three other slaves during the process. Because why? Because you're being examined vaginally, and again, in some cases, even being cut with a scalpel without any form of anesthesia um, in an extremely sensitive area. So again, if you don't know about James Marion Sims, he's known for his success in the obstetric and the world of OBGYNs because of his success. But just remember that he was able to accomplish so much and to make advances in OBGYN services because of basically the experiments that he used or conducted on enslaved African women. And the reason I keep saying borrowed is because he would borrow slaves from other from plantations after for whatever we don't know what happened to his slaves. We can only assume that they probably passed away through the many surgical procedures that he performed on them. But again, these were borrowed slaves that he would then go on to practice on to perfect his OBGYN procedures, which Black women did not benefit from. It was for the health of white women who may have had complications after giving birth. And Dr. Marion Sims was working on the African American women to figure out how to prepare or repair the reproductive systems of white women after complications from birth. We should also note before we move on to the next slide that at some point the white male medical students began to speak out against Dr. Marion Sims and refused to restrain the slaves during the procedures, and also to the point where they refused to study under him, right? So maybe developing a conscience after you see a woman who is conscious and on an examination table having parts of her reproductive system removed with a scalpel without sedation. Perhaps they developed a conscience and said, maybe this isn't something that I really want to be a part of. So again, when you get a moment, I encourage you to look up the harms of James Marion Sims, but also the women, the Black women of the history of gynecology, specifically Anarcha, and there are two other enslaved women that they talk about. Next slide, please. Now we'll talk about systemic and institutional racism in the healthcare system. This is not just the opinions of a few women. This is not just the paranoia of a few women. This is not just the conspiracy theory of Black women. The American College of Obstetricians and Gynecologists are aware of the racism that's in pregnancy care. They've been very vocal about it. They have made many statements about how they plan to deal with it, just like many other institutions after the murder of George Floyd, wanting to be politically correct, wanting to amend the harms that have been done by African Americans. So the American College of Obstetrics and Gynecologists, they were no different. They were they started with Dr. James Marion Sims, but they were pushed into it by Black medical students who talked about the history of Dr. James Marion Sims. So in addition to removing the statues that were in honor of Dr. James Marion Sims, the American College of Obstetrics and Gynecologists began to talk about racism in pregnancy care, that implicit bias, meaning the thoughts or the beliefs that doctors may have about Black American women and how they begin to treat them, or, consciously or unconsciously during their prenatal visits and again in their care. Um, Not to use celebrities, but just to talk about the financial aspect of this, right? I believe there were a couple of celebrities that gave birth that talked about how one who was had a history of dealing with blood clots explained after giving birth that she was not feeling well and how she was ignored by her doctors, and because of who she was, and only because she was this global tennis professional, did the doctors begin to listen to her, to only to find out that she had a blood clot. And had they not listened to her, she would have passed away from that blood clot with complications very similar to what my client passed away from. And then, of course, there is the documentary of Aftershock, and I encourage all of you to take a look at that. It is on Hulu, but again, it follows the trials of Black women dying during the complications of birth, and a lot of it has to deal with the way Black women are treated during prenatal care and while giving childbirth. Okay. There was one particular person who they talk about a lot, and her name was Kira Johnson. And again, it is my opinion, a lot of attention is paid to this case in particular because of who she was. She was the daughter-in-law of the television judge. And now her name escapes me. But she was the daughter-in-law of one of the television judges, and she had a child before. Her name was Kira Johnson. She was an attorney. Her husband was an attorney. The grandfather is an attorney, and then of course the grandmother, who was one of the television judges, was an attorney. All of that to say, when she was giving birth, she told her husband that she wasn't feeling well. The husband then told the doctors. No one listened to her, and she ended up passing away from complications for pregnancy. And again, a lot of attention was given to this situation because of who the mother-in-law was, but also because the husband, an attorney who refused to let things just move past him. Excuse me. And you will also hear the past Vice President Kamala Harris also talk about the case of Kira Johnson. And what we know from studies is that in 2023, 1 in 3 Black, Hispanic, and multiracial women reported mistreatment during their pregnancy care. Next slide, please. So we're also going to talk a little bit about epigenetics. I am not an epidemiologist. All of the information that I know about epigenetics is involving its impact on PMHCs. So epigenetics is the study of the impact of, I'm sorry, epigenetics is the study of the impact of environmental and experimental factors on gene expression without changing the underlying genetic code. It does not change the DNA. However, some of the activity may influence a cellular process, such as the release of hormones that turn genes on and off. So, what it's saying, and if you take a chance, if you have the opportunity to research developmental trauma, what it is saying that the stress that the body endures could be so damaging that it could influence your cellular makeup, right? Basically saying that's because of the overaction of say the stress system, it could actually inhibit some hormones being turned on in other systems, which we'll talk about a little bit more. Next slide, please. So if you can click on this, and I'm going to go a little bit faster, if you could show this news brief, it's about 5 minutes, if that. This is Dr. Fleta Mass Jackson, who has done a lot of research on the term of weathering. Can you?
I don't think it's working.
It's not going to work. Um, okay, so we'll move to the next one then, and the next slide, and we'll talk a little bit more about the effects of weathering. Okay, so weathering is basically systemic and interpersonal racism that Black American women experience, right? So the weathering hypothesis was developed by researcher Arlene Geronimus. And again, it addresses the accelerated aging process of Black American women, and it's attributed to the persistent stress of microaggressions and other forms of discrimination that Black women endure even before they even think about getting pregnant. Okay. So you have premature aging, you have the marginalization and oppression of Black American women, you have the chronic stress of having to endure this. And what we've learned is that this is just an example, right? There's a difference between the chronological age and the biological age of women, Black American women, and say Caucasian women, where you may have two women who are at chronologically 37 years old, but the Black woman's body would actually, or her biological makeup would be the body of a woman who was 47 years old. And again, that is influenced by the accelerated aging that is experienced due to chronic stress from microaggressions or racism. Okay. So when we're talking about weathering, we're talking about the allostatic load, weathering, and then telomere length. And we'll talk about that a little bit more next slide. So these are a lot of terms, I know. I myself am becoming more familiar with the terms and how this works. But when you talk about the allostatic load, it refers to the burden of systems over time in an accumulative way caused by stress and other events. A telomere is considered a biological marker of cellular aging, and they are the secure caps at the end of chromosomes that become shorter based on meiotic division or mitosis cell division. So basically, they're going to become shorter anyway because of the aging process. And what it's saying is that the chronic unbuffered stress influences physical health by producing the allostatic load or the dysregulation of a normal regulatory system. So, saying that the chronic stress actually influences the immune system, if you will, which thereby, because that is overactive, that section is overactive, that it contributes to the acceleration or the aging process of the Black woman's body. This is not something that I have come up with, or again, not the conspiracy theories of Black American women. Studies have found associations between racial discrimination and telomere length. And basically, what it is saying is because Black women experience so much racial discrimination or the stress of enduring chronic stress, that the telomere length is actually shorter in African American women if it is compared to, say, someone who may not have the same experiences like an Irish American woman. So, this would explain the accelerated aging process in the Black woman's body or the Black American woman's body versus the aging of an Irish American woman's body. Next slide. We'll talk about reproductive trauma. I encourage you guys to take a look at this on your own. Everyone has a reproductive story, and that involves whether you want to have children or you don't, right? But everyone's experiences will be different. Fertility journeys could include you go to school, you do everything that you're told to do. Don't have kids until you get married, or make sure you're able to financially take care of kids before you get married. But little do we talk about the situations that could actually affect our fertility journeys, like endometriosis or having children after you have your career, and you're at that stage where they like to refer to it as the geriatric stage. And believe me, this is only at the age of 35 where pregnancies are considered to be geriatric pregnancies, meaning that the reproductive system has aged a little bit more than we would have wanted it to while we're about to start that fertility journey. And then, of course, there are the potential of infertility, where Black women may need assistance with actually becoming pregnant or maintaining pregnancy. I have spoken with women about IVF, not being able to afford IVF. One 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 process of IVF, which is in vitro fertilization, could cost up to $10,000, right? So, who has access to that? So, the complications or the challenges of waiting your whole life to have a child only to find out you have infertility issues and that you can't afford it. And then last, we talked about the birth trauma or the trauma during the childbirth or the delivery process. Next slide. Um, there are barriers to Black women actually that increases a Black woman's chances of developing PMHCs, right? So we already talked about the intrapersonal experience, like the distrust in the healthcare system, the interpersonal experience, which is the shame and stigma of seeking mental health services, right? Our own barriers where I'm not going to go talk to anybody, I'll just pray about it, or it'll go away on its own, or barriers such as lack of access to care. One study showed where there, again, the implicit bias that Black women don't take care of themselves during prenatal care, despite what you tell them they won't eat in a healthy way. One study found that if you were just able to assist the women with transportation, that they were more likely to be more active in their prenatal care and more active in their pregnancy. Um, Another barrier to care is a lack of Black therapists wanting to talk to someone who looks like you, and in my case, who has actually had the lived experiences as you, right? And then, of course, we all know that the screening instruments that are used a lot in mental health are instruments that were developed with white male subjects or even white female subjects, and not necessarily addressing the cultural aspects that may include someone's lived experiences, especially the Black woman in America. Next slide. So risk factors for developing PMHCs, specifically for Black women, the preconception history of untreated mental health challenges, right? Um, Family history of mental health challenges. We all know that the likelihood dealing with serious mental health issues like schizophrenia or bipolar disorder, one's chances increases of actually developing one of these disorders yourself if you have a family member with one of these disorders. Unplanned or unwanted pregnancies, you'll be surprised to learn that most pregnancies are not planned. Sometimes they just happen. I've had clients who were very upset that I wanted to get pregnant. I went off my contraceptive. I wanted to wait a couple of months before I got pregnant, only to find out they got pregnant on their honeymoon night, right? So you had your plans, but the baby had another one. Or in this situation, this society that we're living in now, where you have limitations or what you can do as far as an unwanted pregnancy. So being forced to carry a pregnancy that you do not want, a history of alcohol or substance use, pre-existing medical conditions that can influence mom's pregnancy, community violence, intimate partner violence, and again, financial challenges. I'm going to talk a little bit faster so because we're running out of time. Next slide. But again, talking about those things that we can do to encourage others, because if I want to do anything else in life, it is my goal that if a woman wants to have a baby, that I can assist her with enjoying her pregnancy, just being a part of this journey. How do you do that? You come to seminars like this, and then you spread the word through psychoeducation. Support systems. In this case, we see a woman who is more than likely at a birthing center, and you see her support system working with her, I guess, trying to talk her through the contractions. You have advocacy organizations like Postpartum Support International and some of the other organizations that'll be mentioned in the resources in this slide. And then you have awareness, right? Getting out and talking about it. And then, of course, you want to support policies that include, excuse me, policies um, that will support medical insurance for everyone. Family Medical Leave Act. We're even at the point now where you have to have policy or basically to tell people, maybe you should include a room where women can breastfeed in private so that others aren't offended by her whipping her breasts out in public to feed her child, right? So supporting policy that actually supports Black women in being productive and healthy mothers. Next slide. Next slide. Okay, so if you haven't heard of this, I didn't know about this particular area. Maybe you know someone who wants to be a doctor, or maybe they aren't certain of their career just yet. There is an entire field of mental health that deals with working with women during their reproductive years. So, reproductive psychiatry, and there are two programs here in Illinois. Northwestern is actually well known for their reproductive psychiatry department, and the University of Illinois in Chicago, UIC. So, reproductive psychiatry focuses on treatment of psychiatric disorders in women during the reproductive years, particularly during times of hormonal change. So, if you have someone who already has a diagnosis of bipolar disorder, OBGYNs have been known to tell their patients stop taking the medication because it could harm the baby. Well, you now have psychiatrists that focus on keeping moms on the medication so that they can enjoy their pregnancy experience, but also sometimes they found that having mom discontinue the medication is actually more harmful to the pregnancy than mom actually going on a different medication that could help deal or manage the symptoms of bipolar disorder. And that could help manage those symptoms while she's continuing with her pregnancy. Next slide. And then you have people like myself, a therapist. I'm a licensed clinical social worker, but I also went through a specific training with Postpartum Support International, where I have a certificate and I am known as a perinatal mental health clinician. Well, what does that mean? That means that I took some extra classes so that I would know how to better serve Black American women, which is my focus. And that is not to discount any other races' experiences. It is only to make sure that Black American women, women who are descendants of enslaved Africans, receive the same treatment as those who may be able to financially afford others with the same training, but may not be able to get into their practice. Next slide. And then there are other individuals that can help during this process. Take a look at this on your own. I encourage people. Reproductive psychiatry isn't your issue. Therapy isn't your issue. Of course, we have midwives, we have doulas, we have lactation consultants, we have childbirth educators. Please, please, please research Chicago volunteer doulas. You may have the opportunity to be trained to become a doula. And guess what? Medicaid now pays for doulas. So you can be certified in an area where you could actually practice this on your own individually, and it could be a second income for you. Next slide. And we're wrapping it up. So here are some resources for Black American women, to providers of Black American women. So say you are a person who is not a Black American, but you want to learn a little bit more about PMHCs among Black women. Here are some slides. You can move on to the next one. Here are some resources. A continuation of the resources, and then resources for Black American women themselves, support system. Next slide. And then Black Maternal Mental Health Week is actually observed July 19th through 25th. I hope to do another webinar specifically for Black American women focused on this, but you can Google this on your own. This project was created by Kay Matthews, and it is out of Houston, Texas. But again, you see the YouTube link. You can take a look at all of that on your own. I am Anquinette Perkins. And I'm glad to be here, and I'm glad that you took your time this morning to share this with me. And next slide, and we are done. Questions and answers, hopefully.
Yes, thank you so much, Dr. Perkins, for such a wonderful presentation, so rich and cultured. And I think a lot of people truly enjoyed the content and the passion that was connected to your delivery. I felt it. I knew it felt real and personal, and I love that. And so we have a couple of questions from who
Okay.
were listening in the audience. The first question is, what are the most common perinatal mental health conditions affecting Black women, and how do they typically present?
Okay, so again, the most common ones, but the least diagnosed are perinatal anxiety and the perinatal OCD. And again, because it presents to some as just a new parent worried about situations. Again, as with any other mental health issue, there are traits, there are behaviors. It becomes a disorder when those behaviors actually inhibit the person's ability to function in life. So, again, with the OCD, we talked about mom developing this fear of poisoning the baby or contamination and washing her hands repeatedly to make sure that she does not contaminate the baby in any way. So you have OCD, you have unwanted and obtrusive thoughts that are followed by behaviors that the mom truly believes if she engages in these behaviors, that this will decrease the chances of her actually causing harm to that baby.
Thank you. The next question is, how do systemic racism and healthcare disparities contribute to perinatal mental health outcomes in Black communities?
Okay, that is an awesome question. And it basically it influences it because it influences whether or not mom is going to seek prenatal care, whether a mom is going to continue with prenatal care, and then it stresses mom out, for lack of better words. Who wants to go to a doctor's office where you have someone who's talking to you like you're a child, or who doesn't respect you as a human being, who automatically expects that you don't have a partner, that you're a single mom, or that you're heterosexual for that matter? Who wants to be bothered with the healthcare system that treats you as if you are a second class citizen, but expects their payment as if you are a first class citizen with a lot of opportunities and access to money, right? And again, the chronic stress that goes to the weathering effect, the stress that Black women endure just living in this country. That's talking preconception, right? So you're coming into the pregnancy with a body that has already been affected. And then during pregnancy, we know that pregnancy takes a toll on the body. So you're going into it with a compromised system. The system is becoming even more damaged during the pregnancy. And then the stress of it overall during the pregnancy. And hopefully you don't experience any complications that could add to it postpartum. But again, we're focusing on the positive. And from this point on, we're going to be our sister's keeper. And we're going to make sure that we have advocates that are present so that when mom can't talk for herself, that somebody is there to talk for her.
Wonderful. We do have a follow-up question from one of our
Okay.
favorite community partners, Miss Maxwell from Amazing Doulas Do It, who asked, "Do you feel doulas are helpful?"
I feel doulas are helpful. I'm waiting to hear if I'm going to be accepted into a program to become a volunteer doula. That's how much I believe in doulas, that I want to become one myself. Yes, I have a PhD, but I also want to have the title of doula because I want people to understand and respect the profession of doulas. Also, studies have shown that when doulas are present, women are less likely to receive an unwanted cesarean. Doulas act as an advocate for mom when she can't talk. So basically, when your mom is in the delivery room, and you have that doctor telling her, oh, it's just a part of pregnancy, you'll be fine. You have that advocate, that doula that steps in and says, well, actually, she has a history of blood clots. And when she's saying that she's having problems catching her breath, that may have something to do with that. And I'd like you to go ahead and take a look at that, if you will. And as I pointed out, Illinois Medicaid is now going to pay for doulas in during the pregnancy process. So you can actually go through a doula program, become licensed or certified, and have your own side hustle of helping Black women during their pregnancy experience. You can bill on your own, but I'm not a doula. That agency could probably give you a little bit more information. But again, uh, with all of the alphabet soup behind my last name, I want to add to that a doula because I very much respect the profession. And this is what Black women did before it had a name.
I love that. So just a really good follow-up or interesting question is, how can providers differentiate between cultural expressions of distress and clinical symptoms?
Okay. So cultural expressions, I'm not quite sure what you mean by that. Are Black women more likely to complain than white women? I'm not sure what they're asking.
Yeah, I'm not entirely. They didn't really expound on the concept of cultural. I guess just understanding like
Okay.
how do you express just distress from a standpoint, just your natural expression. It's not anything that's necessarily a response to a clinically diagnosed symptom, and just saying how can a clin. I guess to your point regarding how Black women have, or, sometimes are misunderstood or not heard when expressing pain or anything of that nature. And so the question is how are they able to be able to understand what's an expression of just distress compared to what's something that's clinically related?
Okay, I think I get that question, and I can say the way the liveliness that Black women may use when they're expressing themselves could be perceived as others as intimidating, right? That loud, angry Black woman. I don't have a problem saying that, but sometimes our passion may be mistaken for threats or intimidation by others. But I'm okay with that if it means that the person will get the services that they need. Remember that when you're talking about a mental health issue, it becomes an issue when the behavior becomes problematic and the person isn't able to function in society. That's what makes it a disorder. We all have behavior traits. As I said, I can get a little loud as as my co-presenter pointed out. I can become extremely passionate in some circles, this is perceived as threatening. I don't see it as threatening. I see it as being passionate about my people and the experiences, the lived experiences of Black American women. By that, I say be true to who you are, read the room. Some people can do, what is it? You can get a lot more with sugar than with vinegar. So, depending on the room and where you're at, who you're talking to, and most importantly, what you need. So, if I need to lower my voice because I'm appearing passionate or over dramatic to some, I can do that if it means that I can talk with the doctor about my client not having an unwanted cesarean. Does that make sense?
Absolutely. Thank you so much. Doing your best to get that one. All right. So the last question is, what culturally responsive screening tools do you recommend for assessing perinatal mood and anxiety disorders in Black patients?
To my knowledge, there are none. So if we have some PhDs and other researchers in this webinar that are capable of developing some, I encourage you to think about that. Right now, when postpartum depression is actually assessed, we're using the Edinburgh postnatal depression scale. That's usually done during pregnancy, and then it is done after pregnancy, and then it's done follow up maybe 6 months after pregnancy. But to my knowledge, and please correct me if anyone else knows of anything, there are no culturally sensitive instruments to work specifically with African American women, or in this case, women who are descendants of enslaved Africans in America.
This was such a great webinar, Dr. Perkins. Thank you so much. Now, before I even close this out, I do want to just read one particular comment that one of the audience members left. It said, "This is one of the best educational sessions I have ever heard. It is excellent. Thank you." So I just wanted to share that with you just to reassure that you did a fantastic job. Thank you so much, Dr. Perkins, for your time, your knowledge, information on behalf of the Aurora African American Health Coalition. Again, we're very grateful for this. We hope to be able to have you on again sometime in the near future. So thank you so much.
Thank you for having me. The rest of you enjoy your day. And ending with this, now that you've heard it, you can't unhear it. So now you have to ask yourself what are you going to do to bring awareness and to do your part with helping Black women enjoy this experience of motherhood, because it is a beautiful journey.
Yes, and we that is food for thought and for reflection. And with that being said, a early happy Mother's Day to you and all the other mothers that are listening to this as well. Thank you so much, everyone, and have a good rest of your weekend and see you next time.
Have a good day. Happy Mother's Day to all that choose to be mothers.